First of all, I will apologize on behalf of all the nurses in the world for being hostile to our patient. Our patients are supposed to be our friends. Our patients are supposed to be our friends. We're not supposed to be hostile to anybody. But most at times, I'm not giving excuse. But from the little I know, most at times it's frustration that is making nurses to be hostile. And then sometimes it's work overload, lack of manpower. When you discover that two nurses are taking care of 32 patients, and then you sit down, 10 people will come to your head and tell you, I want this, I want this, I want this, I want this. Another one is crying here, another one is. Sometimes you be confused. I found myself in that stage sometimes. I was on duty, two of us, with 32 patients. In fact, that day, I hated myself. I said, what brought me to this profession? Two of us, one patient is very critically ill on oxygen that we have to be monitoring. At a point, I was writing report. I sat down, I was writing report. 4 patient relatives came and stood on my head. All of them were talking at random. I didn't even know what they were saying. I was just looking at them. When they started talking, I left what I was doing. I was just looking at them. All of them had kept quiet. And I say, are you done? He says, I say, what's your problem? I had to carry paper and mind. What is your problem? What bed? I jotted it down. What is your own? What bed? That's how I dispatched all of them. I said, I'm gone. I had to leave my report, haven't I went to take care of those patients. In Nigeria, we are not following the ideal again. It's one nurse to 12 patients or one nurse to 30 patients. And you don't expect her to do what she's supposed to do perfectly well. Because we work with time. I'm on morning duty. I should be handing over by 1. And then by 12, I've not even done half of my work. You should expect that the remaining work I'll just do it. I'll be sharp. Not minding whether I've achieved my aim, whether I've done the best to the patient or not. I want to hand over and go, which is wrong. So firstly, I will employ more nurses. These days, nurses are leaving the country. Plenty nurses are leaving. So if I were Minister of Health, what I would do is, as nurses are leaving, nurses are graduating every year, or some like School of Nursing, some schools twice a year, they graduate nurses. Employ them. They should come and work. Those that want to leave should leave. Those that are around, let's use them. Another thing is, again, is welfare. The welfare is not encouraging. How much is the salary? Do they give them food when they come to work? No. Do they pay them allowance for feeding? No. In abroad, you are working, you have 1 hour for break. You go and eat and come back to continue your work. But in Nigeria, the reverse is the case. 5 minutes that you used to eat, they will come and tell you are eating, patient is crying, you leave your food. I remember when I was in Babalada, I would cook food from my house, I would take it to the ward. I would end up taking that food back home. Because of the way the work is. It's too demanding. When I have plenty patients to cater for, I have my own family problem waiting for me at home. I have my own other issues at home or other places. Do you expect me to work well? No. That's the truth. Here, I will be selfish because I'm a nurse. I've been affected severally. I lost the pregnancy because of overwork. Yes, when on duty, morning duty, I closed by 4. I was supposed to close by 2. But because of the overwork, I stayed till 4. Immediately I got home, I discovered I was bleeding. I had to shower and went back to the hospital. That's how I lost my pregnancy. So, if a nurse shouts at you, I know it's painful, that you'll be in pain and the nurse will be hostile at you. Please, nobody is teaching us in school how to be hostile. That's the truth. Nobody will teach you that. Nursing is caring. And if you are caring, you won't be hostile. But the reverse is the case. The condition of the country is not favorable again. Nobody cares whether she has eaten this morning to come to work, whether she has trekked from her house to hospital, whether she's fine. Psychologically, if you're not fine, you're not even supposed to come to work. Sickle cell is being treated under general nursing. They teach us that under general nursing. And then it doesn't mean whether I'm a specialist in hematology or not that can take care of a sickle cell patient. If I know about it and if I know my work, I can take care of a sickle cell patient. Not necessarily I must have a qualification in that aspect to take care of it. It bounces back to individuality. I've said it several times. There are nurses that when you read them, you don't want to depart with them. You want to stick to them. You want to stay with them because of the way they will show you care and love. Whereas there are nurses that if you just see them one day, you say, God, don't bring this nurse again to me again. If you see her coming, you want to dodge. So sometimes it's our individual differences. And then sometimes it's the way we choose to do our work. These days, unlike before, the nurses before value nursing profession. But nurses these days is the money they are after. That's why if you're a nurse, they tell you, you are here, hot cake, oh. Every man wants to marry a nurse because they feel there is money. Whereas we, the nurses, are saying that what we're doing, we're not even collecting what we're part of, half of what we're doing because of the way the work is so demanding on us. First of all, when you are in school, either School of Nursing or the university, we treat each condition one by one. And what we're treating, let's say we're treating sickle cell anemia, we start with the anatomy of it. Anatomy of the particular place. If there's a particular place that it affects, we start with the anatomy. Let's know the anatomy of that particular place. Like, let me use liver, let me use hepatitis. We'll treat the anatomy of the liver first, the physiology of the liver. Then we go to the disease condition. On the other disease condition, they will now teach you the signs and symptoms, the causes, the pathophysiology, the management, medical management, nursing management, surgical management, preventive, how you prevent the disease at home or whatever, and then the complications, because every disease has its complication. So it's not that because there is no specialty in hematology, so they just teach us everything combined. As they teach us in school, they teach us every disease one by one. They pick this disease. Today we're treating sickle cell anemia, and then they will start from the beginning of sickle cell anemia, how it affects the body, what causes it, how it goes about, down to its complication. And the first aid that's supposed to be administered to a sickle cell patient at home before taking him to the hospital by the relative. First of all, they are supposed to ensure that the patient is well hydrated. And then the day my uncle called me that his son was having crisis. The first thing I asked him was, is he taking enough fluid? He said, yes. I said, give him fluid. If there is fruit, watermelon, orange, give him. Then take him to the hospital. Because I won't tell you to administer any injection to the patient. I won't tell you to set line. Do you know how to set line with the patient? So you first of all think of hydrating the patient, and then when you do that, then you find your way to the hospital. Sometimes you can even give massage on the particular place that is affected. If it is the hand that the crisis is there, you give the massage there. Give massage before, when the pain is relieved, then you can get your way to the hospital. On your way, you can still continue with the massage. And make sure the patient is okay. My name is Dorcas Nandom. I'm a nurse. I work with the Jos University Teaching Hospital. I'm in Old Youth. I work in the HIV clinic. What I basically do right now is HIV testing and counseling. That's my point of duty presently. And then my appeal to sickle cell patients is that please and please, they should take care of themselves. I always tell them, avoid getting bite by malaria, by mosquito. So try as much as possible as you can to sleep under net, mosquito net. And then avoid during cold weather, avoid walking about without warm clothing because that precipitates crisis. Also, those that take alcohol can reduce if they can't stop. But I always tell people, if you can, stop. And then another thing again is don't get addicted to drugs, especially the analgesic, because it's a big problem when you get addicted to it. No matter how many drugs they will give you, you feel it's not working except they give you that particular drug that you want. So, sickle cell patient can live as long as they want to. And I also tell them, if you have somebody you want to marry, the first thing you ask the patient, what is your genotype? I lost a relationship because both of us were AS. And we were all nurses. So we had to agree that it was not going to work. Because we don't want to give back to children that will end up suffering on earth.